breaking barriers and bridging the gaps between patients and doctors. Welcome to Brainstorming with the Docs and your co-hosts, Dr. Glenn Harrison and Dr. Kolby Condos.
All right, everyone, welcome back to this week's episode of Brainstorming with the Doc. I'm Dr. Kolby Condos, Dr. Glenn Harrison, my co-host. How's it going, bud?
Doing well, doing very well. This is this topic I find interesting because we should have been talking more about this over the months and over years, I guess now. But I'm glad we were getting into something like this. Very, very.
Yeah, I mean, this should technically be right in our wheelhouse because we're both chiropractors. And actually, I've seen like several of these in the past month. I don't know why we've never thought of this. But today we're going to talk about sciatic nerve pain or sciatica. If this is your guys' first time watching or listening to the podcast or on YouTube and you get value out of it, hit like and subscribe, turn on notifications, and send this information to your friends, family members, and loved ones because we'd like to help as many people as we can. But to get started, man, let's talk about sciatica, shall we?
Yes, sciatica. It seemed, I have this friend and she was dealing with some sciatica and I was, I was talking to her and I was like, well, and there was no concept, there was no education, and that's why I brought this up when we were thinking about this topic. She knew nothing about it, and she was at her medical doctor, and she was at even a natural doctor, and she didn't know anything about what was causing her sciatic pain. She was given calcium supplement. Now, I'm not saying all doctors are equal; they never are. Given a calcium supplement for her bones because that was going to help sciatica, and the natural doctor gave her these, electric stim, gave her this little machine to take home to put on the muscles of her leg to help with her sciatica. And I was disgusted. So then I was like, well, people got to know about this. It's not common knowledge. So yes, I'm happy we're doing this. Finally. Yeah,
it's going to be a good one. It affects tons of people. It's a big, big reason for lost time at work. And it can really affect anybody. So first off, what is sciatic nerve pain or what is sciatica? The sciatic nerve is a big nerve that runs down the posterior aspect, the back part of your leg. Burning, pain, tingling, numbness kind of starts at your glutes or sometimes in your low back and goes down the back of your leg.
Right.
Can be debilitating, can range from like completely debilitating to like a really, really big nuisance and annoyance.
That's right. Difficult
and if
to
it goes
stand.
long enough, if it goes long enough or it's severe enough, and it can actually cause issues with muscular endurance and strength.
That's right. Weakness. So why is it so important? I know you were finding some stats on it, how prevalent it was.
Yeah, I mean, it kind of varies. I think it probably varies depending on like what the job is, the demographics as far as like that kind of stuff. But they say that up to 10% of the population experiences sciatic nerve pain at some point.
Wow. Yeah, so it's a real thing. And again,
that's tons of people. You think 10% of the population in the world or in the United States even. That's huge.
Yeah, that is. Yeah, what do you want to think of the numbers on that? So, we talked about what sciatica is. Really, what sciatic is irritation of this nerve. Now, many things irritate these nerves, and when a nerve gets irritated, there's a few things that happen. What are the few things that the patient will experience if any nerve is being irritated?
So yeah, they're going to have, well, depending on the type of nerve, right? But numbness, tingling, burning,
weakness.
Yep.
Or even muscle spasms, I guess.
Yep, muscle spasms, fasciculations if it's gone on long enough, which is where the muscle kind of like twitches.
Okay.
That's got to be pretty far advanced, and the nerve has got to actually be
characteristics. If someone thinks, okay, do I have sciatica? I'm listening to Brainstorm with the docs. We're talking about sciatica. I think I have it. We don't want people to necessarily self-diagnose, but understand really what it is, and maybe they have a symptom they can pair it, or at least they can ask these questions with their care provider. But sciatica usually it doesn't usually go past the knee, right?
I mean, it can go into the foot, but I mean, in my experience, I mean, I've seen it in the foot too, but most commonly it starts and it's like pretty localized to the glute and starts radiating down the back of the leg. Okay. That's early onset. If it's gotten bad enough that it's going into the feet, that's when you need to like maybe have an exam done, because it could possibly be like a herniated disc. It could be nerve root compression. It could be, I mean, we'll go through a little bit of these later on in this.
Yeah. So maybe let's just jump into that if we're ready to. What are the causes of sciatic nerve pain or sciatic nerve irritation? What are some of the causes?
So when I look at...
Did you bring your spine today?
Oh man, I did
Okay,
not
that's
do
okay.
it.
You're just going to act it out then with your
I
hand.
should. Yeah, I should have.
And if you're listening to this on the podcast, you're going to have a great imagination.
Yeah. So when you look at what sciatica is or sciatic nerve irritation is it something is either occupying space that the sciatic nerve normally occupies, it's either compressing it, or there's some sort of, that's pretty much the two mechanisms. Now, what those two things happen from, it can be from things like a herniated disc. It can be from things.
So a herniated disc of the vertebrae.
Yep.
It's squished out like a pancake, and it could be pushing on this nerve, right? So that's a disc problem. So that's one.
And truthfully, most of the time, if it's like a disc herniation, then it's actually hitting like one of the different nerve roots in the spine that travels into the sciatic nerve, which it could get like really busy and messy. So we're just going to say could be a disc.
Could be a disc. So there's one. So it could be a disc.
A muscle in your butt that is called your piriformis muscle.
Butt muscle.
Your butt muscle.
And you remember that in school when we were learning about that muscle, we were torturing each other trying to loosen up this muscle. It can be very painful if it's tight. And most piriformises are pretty tight. So it's a triangular shaped muscle kind of in the mid side of the glute.
Yep. Goes from basically your pelvis to your sacrum. Your sacrum's like the triangle shaped keystone that basically anchors your pelvis to the lower part of your spine. And then it goes to your leg.
Yeah. So it's a relatively small triangular muscle. We'll just say on the side of your butt. Okay. And this muscle can get really, really tight. And the sciatic nerve runs right beside it or right under it. And some people, it actually runs through it. Not very common, but the sciatic nerve can run through it. So when that muscle spasms or gets really, really tight, it can be one of the contributors to create sciatic pain because it's actually squeezing the nerve right in the butt.
Interrupting blood flow to the nerve,
Yeah. So that's the disc, this triangular muscle in your butt, piriformis, also known as piriformis syndrome, right?
Yep.
What is another one?
So you could have like space occupying lesions, right? So this could be infections. This could be anything that basically occupies space. It could be a tumor. It could be
arthritis.
It could be a fatty lipoma. It could be like a million different things. Not a million maybe, but quite a few different things. Anything that takes up space where the sciatic nerve either usually runs through or travels around.
That's right.
So things like arthritis in the lower back can sometimes cause like they call them osteophytes, and those can move into the holes where the nerves exit the spine, and that can cause radiating pain.
Yeah, just bone growing in these spots that are occupying space, putting pressure on the nerve. And I think, that's plays into arthritis. So that's kind of the major causes of sciatica. And you see so many people suffering with it. They're on because what happens if someone has sciatic nerve pain and they go visit their, the standard conventional medicine? What are the strategies?
Well, I mean, it depends on the severity, I guess. And also let's just throw out this too. This is only if it's on one side, right?
That's right.
If it's on both sides, then you need to explore other options as well, like metabolic factors and stuff like that. So this is if you are having pain traveling down the back from your buttock to the back of your leg and one leg, this is something you maybe need to consider. So as far as like what, traditional medical management would look like, muscle relaxers is a possibility. They might refer you to PT. They could potentially put you on some sort of like pain medication. I would say the most common is probably physical therapy or chiropractic referral. But yeah, those are the options as far as that. I think that if you are experiencing sciatic nerve pain or sciatica, getting a really thorough exam is like one of the most beneficial things that you can do as far as like receiving the appropriate management and treatment methods. So really getting a thorough exam is going to help you rule in or out like certain conditions that could maybe be complicating factors. Like, is it a disc herniation? Is it impingement somewhere? Is it, piriformis syndrome? Do we need to be worried about other things? So that's where like a really good physical exam or orthopedic exam comes in handy. And then also if that's inconclusive or something, or it just doesn't make sense, then you can start to explore things like MRI. Which could potentially show you some stuff as well.
If there's anything in the way, any soft tissues,
just imaging in general. Yeah, it could be X-ray, right? They could look for arthritis. If that's inconclusive, then they move to MRI or something like that. So that's how like traditional like Western medicine would handle it. Muscle relaxers, physical therapy, maybe some pain medication. If you were to go somewhere else, then there's a lot of stuff you can do for it. Why don't you give us some strategies?
Yeah, well, that I think the first thing that I want, like even that friend of mine when she was given calcium supplements and electric stim to fire the muscles of her leg, I was concerned right away about, is it piriformis syndrome? And I'm not examining her. Is it piriformis syndrome or is it a disc? Those are the two first things from her description. Again, this is a description. It's not. I'm not involved with it. So my recommendation was first for her, well, maybe go see a chiropractor that works with this. And, they could do a proper physical exam, and they did that, and there was significant relief by 80%. But I didn't, she was good for a few days. And I said, well, what did they say? And they said, oh, no, you don't need to come back. Well, you probably need to go back. It never happened immediately. And so I think that was a recommendation. Also, what I told her too, we got to know if it's a disc or not. The exam should have been able to determine that, or, going and just doing an image. Just go do an MRI. Then rule of the disc in, rule the disc out, and then you can go from there. Also, I recommended some piriformis stretches. So kind of, again, from the outside looking in, I'm not examining, so I'm throwing all these different strategies to hopefully help. A common thing that can be helpful with discs is inversion tables. You can buy those all over, and that's, if anybody has ever seen those, you just kind of strap yourself. Be careful with them.
Yeah,
careful with them. You strap yourselves into them, and you kind of roll backwards, and the weight of your body helps stretch out your lower back. So if it's a disc, it acts as a kind of a at-home decompression therapy, creating space between the vertebrae, or at least taking weight off the vertebrae. So it can be helpful with disc issues. So again, I don't know her story, but I think it's a good example of how I would look at it if I'm not involved in it. And maybe these are some strategies that people listening to this could take on. But nothing beats a physical exam from a physical therapist or a chiropractor or somebody like that.
Someone who's experienced with it, right?
Yeah.
Someone that can rule in or rule out certain scenarios. Like if it is a disc, that should be pretty.
Yeah, but
easy to differentiate.
I think
by someone who knows what they're doing.
That's right. And I think one of the biggest things is, maybe I'm using my friend as an example here. Do not accept only a pill as a fix for this, ever. And do not accept something like muscle stim, or I'll give you an anti-inflammatory vitamin and that's going to fix it. Do not accept these simple, absolutely ridiculous strategies. They are not going to do anything alone for this. Look at the mechanism. So you don't need to suffer with it. And then maybe, Dr. Kolby, you're working with neurology all the time. What are long-term effects of somebody with sciatica where there's this constant nerve impingement going on for years?
Yeah, I mean, the biggest thing is like, it's painful, right? That's a big thing. So, there's all sorts of consequences.
Change your gait would change.
It can changes in gait, can alter like your perception of where your body's at. I think that a big thing would be like, the longer, if it becomes severe enough, right, you can have denervation because of, damage to the nerve, which that's kind of a big deal. When a nerve denervates, it actually pulls out of the muscle, and then the muscle doesn't work anymore.
Yeah, because it's not getting signal.
Yeah. That would be a pretty severe case. I haven't seen that before. That's something that could potentially happen.
Yeah.
But don't let it go, because here's the thing, like, it's going to bother you more before it gets to denervation, right? It's going to hurt. It's going to bother you a lot. And you're going to be exploring options.
Yeah, it'll affect your life. I know many people who they couldn't stand at the counter to do dishes. And these are young people. These aren't people in their 70s or 80s. They can't play with their children. They can't go for walks. They can't do their exercise. It keeps them up at night. It's it can definitely affect life in a big way. And I think that's why we did this. Create some clarity.
Right.
Don't accept a calcium supplement as being a fix for
right.
this, or Tylenol alone.
Right. And as far as other strategies, there's a ton of strategies that can be looked at as like, body work strategies, or like, stretching, or myofascial work, or trigger point therapy, or massage, or just, manual manipulation, or whatever. There's a ton of stuff you can do out there. You can do stuff at home with stretching and foam rolling. and stuff like that.
And you can get past it. Yeah, you can get past sciatica. You don't have to live with it. I guess that's one of those things.
So if you're suffering from it, if you're suffering from pain in your butt, and it's going down the back of your leg, and you're like, I'm at wit's end, maybe consider sciatica. Maybe consider finding someone who is well versed and understands, the differentiation between disc and peripheral nerve impingement, and get after it. Get active with it and take care of it, because there are certain things that you can do that help manage it and even relieve a lot of the symptoms. So that's
right. Yeah.
So pretty brief on this one. But if you guys got any value or information out of this, like it, share it with your friends, family members, and loved ones. Hit like and subscribe, turn on notifications, because we're going to keep rolling information out on both the YouTube channel and on the podcast platforms. And stay tuned, because we're going to come up with something new on the next time. So
that's right.
Until next time, buddy.
All right. Well, thanks, Dr. Kolby. I look forward to the next one. Hopefully it's not a pain in our butt.
Yeah, no kidding. All right, buddy.
Okay,
bye.
Bye-bye.